We've lived with epilepsy in our house since Owen was 5 years old, and we've had a huge learning curve in terms of having to find out exactly what we do in the case of emergency and what we tell others what to do in the case of emergency when we have to give them information about looking after him.
I have had epilepsy for 10 years. I've been on medication since 2010. I've had about 20 seizures in my time, and it's really had an impact on my independence, sort of going out and being able to communicate with people. It's sort of taken that independence away from me because of what I have.
At the age of 18, I started having tonic-clonic seizures, which are the quite dramatic type of seizure. And I've had numerous of these over the years, but they're quite well controlled medication at the moment.
I had this fear of having a seizure on the street and people gathering around and not knowing what to do and kind of being scared and doing the wrong thing.
My experience with epilepsy is as a parent of really a whole sense of worry, really, when your child goes out of the house at the beginning of the day, whether they're going to school or they're going out with their mates. Just that whole thing is in you the entire time of just hoping that they're going to be okay.
As a parent of a teenager, it's really difficult trying to balance the need for Dillon to have freedom, to be independent, to go and do things on his own and travel on his own and be away from us, with kind of the need to know that he's going to get the right care should something happen to him.
Obviously, when I'm in the street, nobody knows why I'm there, what's happened to me. So if I then end up in A&E and I have something on me that can identify to the clinicians there, this person has epilepsy, this is the type of epilepsy they have, this is their current treatment, this is what rescue medication they might need, that's really, really useful and can save valuable time.
If a child goes into hospital, it's a very daunting experience, and it can also be quite a negative experience. If they've got a passport they can hand over to the clinician, to the doctor that's looking after them, it will aid the transition through an A&E process. It'll be quicker, they'll get the right treatment, and we can improve their quality of life.
Whenever a child comes into A&E, we basically have two questions. What's wrong with the child, and how can we best manage them? And the Epilepsy Passport gives us the answers to both of those questions as soon as a child walks through the door. We can give the best individualised management to every child, irrespective of what's causing their epilepsy. And also we can get in touch with the right people who normally manage their epilepsy for advice if we need it.
The passport's really reassuring for people if you're out with friends, trying to have a normal teenage life. It can gain confidence if people don't know about it, because if the information's there, then they can really learn a lot more about your condition.
Being more organised than Owen, I think I would be able to make sure that he would be able to take it around. And I sort of still care for him as well as Mum and Dad do.
Being able to communicate every element of his condition is so important, and indeed giving them enough information to know exactly what to do should something that can often be quite scary occur, and know what to do in the case of that emergency.